Alright, let's start then, because Gene needs his room. Alright.
Halfway through the meeting, they'll take over.
Oh, yeah.
Right.
Okay. We're still short, no? Yeah, we're still short one though, just
Who?
vacancy.
Yeah.
Vacancy.
Oh, yeah.
Andres?
Alright. Pledge, time for the Pledge of Allegiance.
Would you just sign this for me?
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You ready to report? Roll call.
Nick?
Here.
Floyd?
Here.
Valerie? Clay? Andres?
Here. That's it? There's three. Alright. Public comments?
No one registered for public comments.
Okay. Review meeting minutes, April 26, 2023.
I didn't see that. Dress?
It's up to you two.
Motion to approve the meeting minutes.
I'll second.
So Nick?
Yes.
Floyd?
Yes.
Andres?
Yes.
Financial statement, April 2023.
For April, we had $2,576,539 cash on hand. Our net income for April was $516,298. And our total accounts receivable was just over 2.8 million. It's up by about 215,000 from the previous month. And I don't really have any other concerns. Everything else is going good. 3103 is in service, and the state decided to honor our grant request from 2021, so we'll get about 50% back on that. So that's all I have for financials.
Questions?
Motion to approve?
I'll second.
Nick?
Yes.
Floyd?
Yes.
Andres?
Yes.
Consultant contract with Mr. Monahan.
I put copies of his letter for you to review.
Questions? It's pretty much the same as the last time. I don't think nothing really has changed from last meeting. Gabe?
So after speaking with Mr. Downs, he doesn't feel like we'll need him other than finishing out the quick med contract. So if we could just retain him for that little period, I think that'll suffice.
Do the hours have to be approved by anybody before? I guess that's my only concern is if,
We would have to come up with something and have our attorney go through it, come up with something that outlines how we want to approve it and maybe come up with a certain amount or something. So not to exceed a certain amount of time or maybe a certain amount without approval from the board or something like that, just to make it clean.
Right, and if I could, I just want to say that, it's been great having Dan, and it's been nice having him as a consultant in an ongoing fashion, but I just think that, if he isn't needed, he isn't really needed, and I just don't feel like that's necessary anymore. So, having discussed this with Gabe and with Bubba, and I just don't think it's really necessary. And so anyway, that's just my recommendation. It's absolutely correct.
I'm just with Floyd, same thing, make sure that, we're not getting this $100 an hour abused.
Right.
Or it's accounted for.
Absolutely. Absolutely.
And another thing too, I also read in that thing was about the covering of the internet and the cell phone. I mean, conversations are brief. I don't agree with covering that part of it as well.
Understood. I think that gave us some pause as well. It just seemed like that was kind of unnecessary. I don't mean to editorialize on everything you guys
it's
said.
good. I mean, we want to make sure it's
Yeah.
fair with him, but also we don't want to be taking advantage either.
Right, absolutely.
I don't know,
Absolutely.
maybe something we can do where if we, how long is this quick med claim gonna be?
I can't imagine it would take too much longer. I think we're nearing the final process right now. We gave them some final numbers last week or the week before.
So a month, 2 months, 3 months?
I'm guessing no longer than 3 months, but probably less than that.
I mean, the phone calls would be easy for him to track the time on. Texts are gonna be the only thing, texts and emails. How do you put a time?
Stamp on those, yeah.
Right.
Yeah, we just,
You know,
No, I totally agree. I think
Every
something
10 texts is X number of, we
hours.
pay for X number of time. I don't know if that's a possibility or not.
I think it would have to be either phone calls or email.
What happens if we did, I don't know, we're throwing this out there, I know what he needs this done sooner than later, same for you. Why don't we just give him a certain amount of hours per month and just, cause he's, I think it's gonna be a problem. I think it's gonna come back and say, okay, you know, I worked 20 hours or I worked 40 hours or whatever the case may be. How do we, you know, disprove that?
Right.
Yeah.
So I don't know if we come up with maybe, I don't know, 20 hours a month, I don't know what the number you would need.
Are you saying a max or just pay him $20?
Just pay him for 20 hours a month and call it a day. It's only for 2 months anyway, so maybe a total of 40 hours for the next 2 months. I don't know.
Are we sure it's gonna be 2 months or is there?
No, I'm just guessing.
Yeah,
I mean, it's been drug out quite a while,
right.
but I think we're at the end process. I really do.
I think like Nick said, it's gonna be kind of hard for you guys to keep track of, you know, going through all the logs and finding out the times and, you know, texts and phone calls. I think that's gonna be more complicated, more time consuming for you guys to try to figure out that time frame.
I agree.
Because I mean, I think
Yeah.
it could be easily abused. I don't know if we want to call him, Gabe, before we vote on this and say, hey, what would it take for you to, you know, give us X amount of hours per month, and then just figure out what the number would be. I mean, obviously, he wants $100 a month, $100 an hour, so if it's 20 hours, you know, that's $2,000.
I was gonna suggest maybe have the attorney draft something up for you guys to look at and vote at on the next meeting or something.
That's fine. I just don't want to see this turn into a mess, and then we're
Right.
paying out numbers where 5,000, 6,000.
Astronomical numbers, yeah.
Right. Happy to do that. I'll get with you, Gabe, and, yeah, happy to do that.
My only concern would be that he's probably gonna continue working through that month, that period of that month
Right.
with QuickMed, so he
We could
may
back pay
not
him.
wanna be left hanging dry for that time as well. Something to consider.
Yeah. Right. How about if, I'll draft something up in short order, and with your blessing, we'll just make sure that Dan understands. Maybe we'll even have an hourly maximum, like a do not exceed. We agree to pay you at your requested contractual rate. Under no circumstances are we able to like go over 20 hours maybe, and per month, something to that effect. Do you think? And your hours are subject to review. And even if you're going to be investing any significant time period in a matter like this, they be pre-approved, your hours be pre-approved.
I think so that would
I
work.
think that's fair.
Okay.
And
I want to be fair with it too. I mean, obviously,
I agree.
He's still conducting business for us,
Right.
but I don't want this to turn into a.
And then not pay for his internet and phone.
Right.
And
Right.
if it helps, if memory serves me correctly, we have not had any contact with him since his contract has expired.
I think that's right, I haven't.
And so it would be easy to track emails or phone calls from that point on if we do need a back pay or something.
Right, good
We'll just
point.
make sure that I follow up with email or phone call.
Yeah,
We'll just do it that way, in case we need a back pay.
good.
So, the phone thing, you gonna leave it or take it out? Or you
I'd
wanna leave it?
take it out.
Take it out.
Yeah,
So I would say less if you would just in the letter advise him to send those devices to us.
okay,
I can get with you and tell you what those devices are.
good. And I'll get with both of you guys and Barb, and we just make sure we have all the
When I think in
Things
his
in order.
contract, he was keeping his phone number, correct?
Yes. 'Cause-
Yeah.
And
Yes.
then the contract was written. yeah.
That's fine, that's okay.
Yeah.
So what is he using for internet out there?
So he has a hotspot, he has an iPad, and he has a phone, to my knowledge.
okay.
Fair enough. Okay. All right, internship, scholarship program.
So right now, we're gonna be on a little bit on a hold. We gotta straighten some things out with Trinidad State College. We drew up, and you should have in your packets, kind of the introduction to that and what we've come up with. What we came up with is, right now the state has Care Forward Colorado grants, and that's paying for EMS training. The head of the EMT section at Trinidad State is saying that they haven't done that yet, but yet we know at other colleges they are doing that through December of 2024, so we have to need to iron that out. The other thing is there's really no need for us to do that internship because we wouldn't have any money outlay to have a contract or anything like that. So that's kind of where we're at. And Nick, I'd be more than happy to kind of, because I know you were really interested in this, and we can have an offline discussion as far as what your idea was and if there's something else we can do with that.
No, if he's paying for it, that's great. I just figure we can, get people that are interested in this field, get them aboard. That way
Right.
you guys have a pool of applicants to pull from.
And I think it's absolutely something we can do, and after talking amongst ourselves in the office, with us not putting out any money, it would be hard to have something like that. So in turn, they would pass the course, they would put an application in, and then we'd go through the hiring process.
So what happens if Trinidad State says, oh, we're not doing that program? Then what do we do?
Then we can look at implementing the scholarship, something like that.
I just hate to see, Ginny puts all that work and effort into these kids and then we don't draw from that. That's kind of craziness.
Yeah, no, it's something that we could do going forward. It's just this year, and if there's money left over in 2024, it didn't make sense for us to go through this whole process to buy them a $300 book or something.
Right.
So moving forward, I think it'll be a good process and a good plan. It's just, the state's getting that money right now, and so we might as well use that to our advantage and not tie up a student with us if they wanted to move on to something different.
Fair enough.
That's kind of our thought.
Good enough for me. Good. All right, Ms. Barber, oath of office.
Are you gentlemen ready to become members of our board? So I'd ask you to stand up.
Doesn't look sure.
Okay, maybe I shouldn't have asked that, but maybe I should have just said stand ahead. So I'm going to read off your oath of office and just ask you to insert your name and then repeat after me.
Yeah, otherwise they can take photos.
So if you would raise your right hand, and I'm going to say I, and then ask you to state your names.
Thomas Murphy, Zachary Shapiro.
Now repeat after me. Do affirm that I will support the Constitution of the United States,
Do affirm that I will support the Constitution of the United States,
the Constitution of the State of Colorado,
the Constitution of the State of Colorado,
and the laws of the State of Colorado,
and the laws of the State of Colorado,
and will faithfully perform the duties of the office
and will faithfully perform the duties of the office
of Director of Trinidad Ambulance District,
of Director of Trinidad Ambulance District,
upon which I am about to enter to the best of my ability.
upon which I am about to enter with the best of my ability.
Thank you. So if you wouldn't mind coming over here, and I will ask you to sign some paperwork. And I can notarize these and we'll ship them right up. Yeah. So Zach, if you would.
So you have to check me from him.
Yeah, oh yeah, that's right.
That's too late.
Yeah, right.
If you have to do it for him, you have to do it for all of us.
Okay.
Yeah, yeah,
I
really.
can, I got the power.
I think it's like this,
And this is your address?
Yep.
Is it too late for Clay to call in?
Oh, yeah. I put it up here.
Is it too late for Clay to call in? No?
It's not
Well,
too-
yeah.
It's not too late, but he won't be able to vote or do anything.
Yeah,
so he
he's
just be listening
basically
in.
officially done now,
Right.
so.
Yeah, once these two take office.
Yeah.
So if you'll sign here and there.
And then there's short.
Okay. Is that gonna be appointed or what are you doing? Yeah, okay.
And then I'm going to give you this, and you can, if you want to take that back to your seat.
Is
and
Tiny
fill
gonna
that
get on,
out.
Bubba?
That's
fine.
I'm all done.
He's gonna have to get on
Thank you.
sooner than now.
He's tied up till 5.
Congratulations.
Thank you, sir.
Absolutely.
I'm gonna send him
Good to have you on.
Yeah, I don't know what they
Good to
were doing for that, I'm not sure.
It's from the law, from your law firm.
Yeah, I don't know.
All right, fine.
All right, there.
Good luck,
It's
everyone.
it's
Good work, Carrie's
official.
done. Yeah.
Just to go sell cars.
Yeah, that's right.
Is he coming from the water parade or what?
Oh, the John's wife's class,
Ah.
they do stuff for 9/11 at the EMS week.
So if you would also sign, that if you would use a blue pen in there for me.
So they gave us they made little bitty bags and did those drawings. There's some cool ones in there.
Yeah.
They make me happy.
Thank you. You're in.
I love them. I
You know,
absolutely love them.
It's not easy to make you happy
After that
sometimes.
astounding review, I'll look through it.
Yeah, exactly. That's a ringing endorsement.
Yeah.
Yeah,
There's one from last year still up
This is Tom's.
above the secret. It says, "You dudes are so good at your job. Thank you."
That's a keeper.
You do.
That's a keeper, yeah.
Tom, I will need you to fill
You
this
dudes are
out
pretty
for
cool.
me as well.
Yeah, that's right, yeah.
Can I?
Yep, not my job. Yep. Would you like to introduce everybody who's here for our new board members?
Sure, we'll go down the line and they can introduce themselves. That's probably the best way to do it. Zach, you're up first. We'll go down the line.
How detailed are we going?
I just give a brief, just give yourself a brief, who you
Zach.
are, where you're from, how you got here.
Zach Shapiro, I'm from Georgia, basically. I was an Air Force brat, so I'm from Illinois, but I grew up in Georgia. I was in EMT for Grady Ambulance and for Bartow County Ambulance. Something I care about, being in this kind of tiny town.
Awesome.
Good, nice.
So Tom Murphy, owner of Trinidad Times TV, Malin Murphy Funeral Home. I've been here since 1982. My family came here in November of 1981. The ambulance holds a special place in my heart because 18 years ago, it was the first thing that I ever set up and filmed. And there's a lot of a story of what happened. There were some very difficult times. This district came within hours of being shut down, and I was there for all that. And I wrote it. I had a candidate forum for it, and I pat myself in the back with sticking it out. I mean, there were some ugly, ugly meetings and some threats, you know, at some of those meetings, and it was hard to stick my neck out and say that we're going to do this. But when I was on the ambulance, or not the ambulance, but the YMCA back 30 years ago, we always talked about the 3 pillars of community, which is education, recreation, and healthcare. And the ambulance is, you know, the front line of healthcare. And so where we are today, I'm very proud of where we are, because what happened 18 years ago, I'm gonna start posting some of that. The first thing I did was the ambulance in the city council, which when I first went in there, I'm not gonna say the gentleman's name at the time, it was the city manager. He's a good guy, but he said, "Who gave you the right to do this?" Or which council member told you you could film? I said, the First Amendment.
Absolutely.
So that's why I'm here. In all honesty, when I asked you guys when the deadline was, I had no intention of putting my name in for this. I wanted Zach to do it because he has experience as an EMT, and I think that's very valuable for you guys. But I mean, it's a little bit really disappointing that more people in this community don't care.
Right.
So, but that's my story. There's more, but you have to buy the book.
Thank you. Welcome aboard, you two.
Yeah, welcome.
Welcome. All
I'm
right.
Andres De Leon. I've been a long-time resident here since I was born. This is my first time ever being a board member, being involved in something like this, so it's been quite an experience for me. Pretty much it. That's all I have.
I'm David Trey, Deputy Chief for Trinidad Ambulance. I've been with Trinidad Ambulance as of March of this year for 15 years. Absolutely the best place I've ever worked. And paramedic level. And I live in La Vida.
Loca?
Been doing. What's
That's
that?
funny.
Sorry.
La Vida Loca.
That was perfect.
Yeah, that's right.
And I've been in emergency services at the level of firefighter, fire chief, and other things since 1993.
Well, I'm a citizen now.
Floyd's just a citizen.
I'm just a citizen. They're offboarding me today, so.
Well, and I'm Barbara Fisk. I'm the administrative assistant for the district and the board and the E911 board. And moved here about 12 years ago and have worked with the district for 8 prior to working for the city. Like you, kind of moved all around the country a lot.
Yeah.
And have to admit that this is the finest place I've ever had the joy of working for, so.
Nick Madranos, my second term. second go around. Been in public safety for the last 24 years, and that's why I'm here, just for the citizens of the county. I'm not here for any other reason. I have no agendas. I'm here for the citizens, so they come first, and then employees.
Gabriel Moreno, I'm the executive director. I've been in fire and EMS for, this will be my 22nd year. Started in Raton and moved up to Pueblo, worked for AMR for about 10 years and ended up down here. Absolutely love it. Paramedic level, it's probably my biggest achievement is becoming a paramedic. So, love it here, doing great things. We're moving in a good direction and welcome aboard.
Okay, Bubba, I guess we're on you.
I have sent him a text and I have not gotten anything back yet. He was
He
gonna be
didn't
on at 5.
he didn't respond. So,
Do you wanna, can we jump around, is it?
yeah.
We can jump around to a director's report till we get more information on these other two.
Yeah, Catherine's on there just waiting. We
Why
gotta
do
do
you-
a presentation and then we can do the service plan stuff. So 9 to 10.
Who you want to review?
We'll go to the directors.
Okay.
Director's report. Dr. DeWall will be here tomorrow for in-person training. We already talked about the quick med stuff. All the numbers were submitted via secure link and we're just waiting on Dan and their attorney to review them and come back with an offer. USDA contracts, or the new building contract has been sent to the USDA, so they're reviewing it. And we just heard back from the Bank of San Juan's on the interim loan. They have to go through the appraisal process again because it's been so long, and they will let us know what we need to go from there. As I said earlier, 3103's been back in service for 2 to 3 weeks. It's running great, and the grant's gonna pick that up. And the grant for last year to re-chassis 1501, still don't have any word on that. There's no production date, no VIN number, nothing like that. And then just a few minor updates. I said on the Grand Ambulance and Patient Billing Committee webinar on May 2nd, nothing big there. May 3rd was a 2-day webinar, so I did that 2 days. May 5th, we had an emergency meeting with the Special District Association. So the state and the governor are going after a property tax reduction, which is really gonna affect our numbers. And a lot of special districts are gonna be hit by that, and so there was an emergency meeting for everybody to kind of voice their concerns. So we're not sure how that's gonna play out. May 8th, we participated in the mock accident drill at Trinidad High School for graduation, and that was really neat. May 11th, Bubba and I went up to graduation for PCC up in Pueblo. Liz walked. She finished paramedic school. She's just got to go through an internship portion. And Mitch is also graduated, but he didn't walk. But they're both going through their internship portion, and hopefully we'll have 2 paramedics by the end of summer. So, going good there. On May 12th, we had the Centac grant review. So that was the review for this year. We're asking for 2 Lucas devices and 3 transport ventilators. And that went very well. They had very little questions. They were really impressed with our grant, and so I think we're gonna get that. So we should have those by the end of the year. May 15th, we sat in on, and I don't even remember how we came across them. So Lexipol offers sort of wellness app. And it was gonna be just under $4,000 for the year for us to get all of our staff on it. And so what it is you download this app, and there's one login, so everything's anonymous. And it'll have contact numbers for like the National Suicide Hotline. It'll have contact numbers for state suicide and wellness care. It'll have phone numbers for if we partner with local therapists and stuff. So they can get on this app and they can find the number and they can contact whoever they need to reach out to. And it's for mental health, it's for personal problems, it's for whatever kind of issues you're having. You can get on this app and do make contacts. The other cool thing about it is it covers their families. And so the staff would have one login and the families would have one login. So you can track who's using it more, the staff or the families, but it's still all anonymous, so you don't know who is doing it, but you can see what they're doing. So if there's people having marital issues and that's the most calls, then we can focus some kind of training or some kind of wellness care towards something like that. So I think this is a great app. It's something that we're looking strongly at.
What's the name of the app?
It's Cortico Wellness. And we made sure that they would include our QRTs, our volunteer QRTs, in this too.
Hey, Tony.
So this would cover all of our staff, their families, the QRTs and their families.
Okay.
For just under $4,000 a year. So I was really impressed with it. I thought it was great. May 18th, we participated in the Water Festival at Trinidad State College. That went well. Judy had his EMR students out there and they did presentation on dehydration and hydration. And then yesterday, May 23rd, I submitted and certified the Medicare cost report, so that's done and gone, thank God. So we'll see what they do with that. And I don't know if you guys are aware, so basically Medicare came in 2019, and so they want all ground ambulances to report all their operating numbers. And from that, they're gonna decide how much reimbursement we should get as far as Medicare and Medicaid goes, because right now it's not nearly enough. And so they're gonna take all these numbers, year 1 and year 2 are supposed to report by May 31st, year 3 and year 4 will report next year. And they'll eventually take all these numbers and figure out what it costs to operate an ambulance, and then they'll come out with hopefully better reimbursement. So that was a mandatory thing. If we failed to do it, we were gonna get a 10% reduction in Medicare, but that's gone and submitted and we're good, so. And that's all I have.
Let's see what the man says on the phone.
Okay. What miscellaneous?
No, it's not. No, it's not. It's Barbara.
Barbara dot app, sorry, Barbara dot.
Leave it to Bobo.
He's just a big teddy bear.
Yep. See if any other check signs that anybody else need to have their check
It's
signs?
just you two. Andres was gonna say that.
Okay, got their checks. Signs over there.
So I can
Or no,
send that
what about
to you
please?
as well.
I think it's all signed.
His is signed, but he's
He's
not
not
here. Yeah, I'll avoid that one.
Sir?
He was holding them for ransom.
Yeah.
I just want to get off and I didn't interrupt anybody, so.
I just wanna make sure everybody got there where they needed to go.
G,
He was like, depends on how quick we get out of here.
Yeah, checks upon a timely adjournment. Yeah.
You fill him in?
It's almost like I wasn't here, huh?
One showing 459, the other one showing 501.
Did you hire that guy? I didn't.
I did it.
Poor Bubba.
That was my vote.
I didn't second that either.
No motion was called. I don't know how you got here.
So I have his, I have,
My signature's not nowhere near that one.
I have his email.
I remember when Bubba first started.
Forwarded again.
Yeah, look what the cat drug in.
Here he is, hi.
You timed that perfectly,
Come on in, Mr.
I'll
Susan.
move that we,
You don't get to move anything anymore. Here.
You're moving.
Do I need to
The only
forward
move
this?
is you.
Bubba,
Bubba,
need
do
you
I
to
need,
focus.
do I need to forward this to him again?
No, he should be
There
signing
he
up.
is. Okay.
This one's
Where
got
is it?
spaceship in it.
Does it?
Uh-oh, where'd it go?
Oh,
There it
yeah.
is. Oh, mine
Wow, wow.
Where is he?
Because you guys are out of this world.
Yeah, yeah, that's right.
I don't know
More
if
ways than one.
I heard it ping.
They're talking about you, Bubba.
Go to your waiting room.
Sure they are.
Waiting
I
room.
didn't do this though, so. Bubba gets blamed for a lot.
You're an easy guy to blame, Bubba.
Biggest target.
Hang on, everybody. That's not it. Where the heck?
I drew all those for you. Yeah.
he's quite the artist.
I know.
Says he's registered, okay. Where is he?
It's like it,
How do I
I'm
go
driving or
to-
something.
Have a wonderful summer. Almost like we have summers off or
Yeah.
something.
Yeah. Everything's
Not
fine.
yet. I'm waiting on him.
Aw. Oh, this one goes with the one that you showed me earlier. It says, thank you for saving my dad to come alive.
Nice.
Oh, it
Sincerely,
does.
Cruz.
Yeah.
Oh, yeah, there was one in here that was thank you for saving Cruz's dad.
Yes,
yeah,
that's the
Totally.
one.
Yep.
Yeah.
All right, where is he? I don't know how to find him.
So he says, my Zoom has picked right now to require a mandatory update.
Oh, okay, well, I thought it was me, which it very well could have been, but,
So I would just leave it there, and I'm sure he's gonna come on just as soon as that gets done.
okay. Do we want to go ahead and do the operations report while he's getting updated?
That'd be you.
I'm totally fine with that.
All right, let's go with operations report.
All right, operations for, this will be for the month of April, delivered to you May 24th. 188 calls for service. Medic 3 had 1 call. 31 in the facilities. Total interfacility miles were 6,568. Just to add a little bit more to kudos to Chief's report on Liz. She also graduated not only paramedic school, but she graduated with an associate's in applied science with an emphasis in EMS. So she'll add that big long thing to her name. Completed the advocacy committee, which is looking at the legislation and stuff. Worked with that. That kind of helped out with the SDA stuff. That ended with the legislation ending for the year. We are actually going to pick up back on that committee probably in July. so that we can get ahead of the game and pull together what we want to ask for, and if there's any legislation we want to pull forward. Obviously, one of the big ones is gonna be looking at this property tax. And also applied, we wanted someone from the district to apply for the Regional Medical Director Committee that all the medical directors within the regional sit on. We do believe that one of the employees also did, so I will confirm that, and then I'll probably back out of that, just due to the fact that we wanted to make sure that we were part of that. And I have an interview scheduled for June 1st. Carrie McNally is in her full-time FTO program, and Tyler's in his part-time FTO program. We also have hired an additional EMT that will be starting an FTO program, field training officer program, fairly soon. Carrie, Tyler, and Amanda just completed their IV class that we require, and Paramedic Cordova taught that, and they'll be getting their 10 required sticks, and then they'll be able to handle the IV side of things. Liz is back to full duty, still limping a little bit, but she's been released. She's not only doing her full shift here, but she's also doing her internship for paramedic school. So that she'll be working on that, as well as Mitch is working on his, he says some clinicals to fulfill with the hospitals, and then he'll work on his internship, which the internship is roughly about 500 hours on the ambulance. So, good news this month, we have 4 of the 5 rigs in service now that we got 3103 back from Rechassis. We are just awaiting 1701 to get the engine put in. D&T was going to start, I believe, today or tomorrow or Friday on tearing that down so that we can get that engine back in. And then we have 2001 needs to go to Albuquerque for some recall stuff, and that's going to be doing the week of June 5th. That's about all I had.
Okay. Like your buddy.
There he is.
This will be a community paramedic presentation, Eagle County.
Yes. So this is actually James McLaughlin, and he is not from Eagle County. He's from UPass Health Service District up in Teller County. And I just had he is the director for community paramedicine for UPass. I had his bio to give him the good introduction, and then when we were looking for Zoom, I clicked out of that, Tiny. So one thing is, Tiny says that he's a paramedic at heart. So he has a BS in international finance, and is a paramedic and a community paramedic. So his nickname is Tiny. That's how we know him, like my nickname is Bubba. So Tiny, I'll leave that to you.
He's still muted.
You're muted, Tiny.
Appreciate that. I swear I've been here before. Hey, no, those are very kind words. Thank you very much. And absolutely, guys, I'm honored to be here, and I'm hoping I can help you in any way I can. It wasn't that long ago that UPass was in the same boat. And if it wasn't for the generosity of others and the support from others, we wouldn't be where we are today. So, this stuff doesn't happen by itself. And you guys got a great leadership team. You've got, from the folks from your team that I've met, they're just absolutely passionate. And I think you guys are going great places. And if there's anything we can do to help you guys, I look forward to that. So, with that said, do you want me to jump right into a presentation, or does anybody have questions first, or how do you guys want to do this?
Why don't you go ahead and jump in, Tiny?
Alright, so let me go to share my screen. That's my fearless leader right there. Everybody see him?
We can.
Okay. I'm hoping that this will play from the beginning. There we go. All right, all you should see is a presentation now. Is that correct?
Correct.
Awesome. All right, so a little bit about myself. You already heard most of it. I am a paramedic at heart. That's really, you know, I love to get out on the truck still and still run calls and spend as little bit of time behind the desk as humanly possible. I still love being out there with my crews, and it's something I really look forward to. I also like going and teaching and doing education and that kind of stuff. So our program started in 2012, and we started seeing our first patient. We went live with our community paramedic program in December. On December 1st of 2014, that was our first behavioral health patient. So just give you a little bit of background on our program. I'm going to go through this part quickly, and then we'll talk about opportunities as it relates to you guys and where you can go with the future, and where you guys want to head, just recommendations here in a bit, okay? So my boss is Tim Dienst. He's the CEO of our organization. Our operations chief is Dave Hansher. We share a medical director. Jerry DeWall is also our medical director, and I can't say enough good things about him. He brings a lot of incredible things to the table, but dedication is number one. Then there's myself. We also work with Eric Murray from Southwest Teller EMS because we've expanded a pilot project down into their area, and then several other folks from other organizations. So a little bit about our organization as a whole. We have 40 years of dedicated service to the region. We have a stable, dedicated workforce. We don't have a ton of turnover. We do have a pretty nationally renowned advanced scope of practice. And we had one of the first licensed community integrated health carrier KISS licenses in the state of Colorado. And then we have a pretty robust behavioral health program. So that's our mission statement. Our behavioral health program is called MAP, or Mental Health Assessment Program. It's part of the statewide crisis system through the Office of Behavioral Health. It was established in December of 2014. So we work alongside over 2,100 other people that provide services. We've transported over 2,100 patients since the program started, sorry. Over 2/3 of our patients have been diverted away from the emergency room to alternative destinations, and that's probably the most important thing, because it says $3 million here, but we're actually up to about $4 million in downstream cost savings. And when we talk about that, what we're actually doing there is we're actually saving the local employers money, we're saving the patients money, we're saving the taxpayers money, right? Because the employers pay less for health insurance if fewer patients are going to the most expensive place to go. And we're saving the client's money because they're not paying as much in deductibles and co-insurance and things like that. If we're helping the insurance companies save money, they actually do send some of that, they're required to send some of that cost savings down to the bottom line. So also it returns ambulances to service much faster, and we get patients navigated to the appropriate levels of care. So, but the thing I'm most proud of is our client satisfaction score in this program is a 4.6 out of 5. So these are patients that are in crisis, that are struggling with the healthcare system, and their satisfaction score is 4.6 out of 5. So we really think with this program we're meeting what the healthcare system calls the triple aim, which is we're improving outcomes, decreasing the cost of care, and improving the patient experience as a whole. And really, when you hit that triple aim, you become the value option in your community, and people really see the value that you bring as a resource to the community. So, and it really does. It brings people to your side, which I think is so important, right? Southwest Teller, so these are some of the project partners that we work with. Our local law enforcement agencies have been really one of our most valuable partners. And then public health is the other group that has just, you know, they were definitely adversarial in the beginning and kind of standoffish. But through COVID, we really proved our partnership and our value through the community paramedic program. And we've really seen that relationship flourish. And I mean, it's absolutely amazing how well we interact with each other. We do trainings together now. We'll put on a class and invite their folks, and they'll show up in the same. They'll put on a class, and they'll invite our folks, and we'll show up. And it's really created this absolutely incredible collaborative partnership. And we see the same thing with law enforcement, where we put on a hostage negotiator class, and we opened up spots for all of our local law enforcement agencies, and they sent about 15 people to the program. So I've never seen that anywhere in healthcare, and really that's what community paramedicine does, is it creates opportunities to collaborate with other partners. I can't emphasize enough the importance of collaboration with the medical director, and you guys have absolutely the perfect medical director for this. So he is award-winning. He has won state awards. He's also, he's humble, so he won't mention this, but he was named a few years ago in the 30 to 30, the 30 most influential people in the state, 30 years of age or younger. So actively, go ahead. Does somebody have a question? Sorry.
No, that was the radio, sorry.
Oh, sorry, no, you're okay. Actively involved in utilizing proactive evidence-based approaches. Everything we do is evidence-based, and that's driven by our medical director. You know, we don't do things because they're cool. We'll do things because they're the best approach for the patient. And I know that you guys, in talking with your leadership team, that you guys have the same philosophy, and that's probably why you have the medical director you have. So, and then he's very engaging. He's energized. He's compassionate. And he's experienced. You know, when you guys start talking about community paramedicine, he's going to get it because he's been there. He's walked the walk. So, and he embraces a just culture approach, which means, you know, we're not out to get providers in trouble. We're out to find the systemic causes for any issues that arise, so that we can improve the systems approaches. So our home project is the other program. So our behavioral health program looks like this. Instead of sending an ambulance and a fire engine and a bunch of police officers every time somebody's in behavioral health or substance use disorder crisis, we send one SUV with a secured area in the back and a community paramedic with one law enforcement officer in their own vehicle. We de-escalate the crisis through a process called motivational interviewing, actively listening to the patient. We medically clear them on site, and then we do telebehavioral health with our behavioral health partner. For us, it's Diversis, and I think you guys work with somebody else, Mind Springs, or I can't remember. So so you would be able, potentially with something like this, to do telehealth with them, telebehavioral health. They would de-escalate the crisis and then get them set up with services. You could even do this potentially with your telehealth partner. If you work with the physicians group, they could actually do a lot of the same things, and you wouldn't need that telebehavioral health partner to do it. So the next one is the home program, and that's our telehealth, our regular telehealth program where we work with board certified emergency physicians and Pulsera. And really our goal here was to increase access to care for marginalized populations. One of the things that our two organizations have in common is we both have pretty geographically isolated patient populations. I mean, we have access to critical access hospital, but there aren't as many services as you'll see in a major metropolitan area, right? So there aren't a lot of behavioral health resources, there aren't a lot of fall prevention resources, there aren't a lot of medication-assisted treatment programs. And so patients tend to, because they have less access to care, they tend to be marginalized. And so by having a program like this and identifying who your community partners are, you're able to tie patients into those resources, into those social determinants of health, which improves access to care and actually ultimately improves outcomes, because you're getting them set up with a primary care doctor if they don't have a primary care doctor. You're getting them set up with a DHS so they can get Medicaid if that's what they need, or Medicare, and they can get on the health exchange for private insurance. And we know that the number one reason that people don't have access to care is because they don't have health insurance. So they qualify for it, let's get them set up with that. And then they're going to be less likely to depend on the 911 system for their preventative care and their other services that we so often see people turn to the 911 system for, because they don't have access to care in other ways. So, so our target population, again, is those in need. The scope we've talked about a little bit. Data flows, we use Pulsera as the tool to manage these patient populations. We can do telehealth through it. We use end-to-end 250-bit encryption, so everything's HIPAA compliant. And we're able to transfer this information in real time to either the physician or to our telebehavioral health program. So we're also able to use some of these same approaches to manage patients that are high system utilizers, so that go to the ER on a regular basis, or who call 911 on a regular basis. We can actually set up partnerships with their primary care physicians to actually develop a treatment plan or a care plan for that specific patient, and go out and do follow-up visits and things like that. And that significantly reduces, because in a rural community where you only have limited resources, as you guys can attest, you have one patient that calls 3 or 4 times a week, that is a major, your system takes a major hit. And so it doesn't take 2 or 3 patients to really have an impact on your system. One patient who calls 3 or 4 times a week can actually impact your system in a meaningful way. Would you guys agree?
Agreed.
Absolutely.
Yeah.
So, so target populations for us, obviously, and a lot of these target populations are the ones that if you have a need for that in your community, you're going to be able to seek grant funding to support your program more aggressively. So obviously minorities, geriatric population is huge. Geriatric care and access to care for geriatric patients in isolated areas is kind of huge. The socially isolated, the Center for Disease Control just recently identified loneliness as the #1 prevailing disease process in the United States. It said that people who were lonely or isolated were 30% more likely to die from heart disease, like 60% more likely to develop diabetes and hypertension, and it's a major contributing factor or comorbidity and a lot of other healthcare related things such as depression, anxiety, isolation, and suicidality. So, geographically isolated persons with limited mobility, economically disadvantaged, those with substance use disorder. Obviously, you know that the state's going to start giving out the opioid money soon, and there's a really good chance that if you guys want to start a program like this, you can tie into that opioid money if you have a solution. So I would definitely, if you haven't done so already, reach out to your county and see what they're doing with those funds. And they should start making those grants very soon, because they're going to be getting the money from the state very, very soon. So most counties that I've heard of either already done it or they're going to start doing it in June or July. Do you guys know where those funds are coming in your community?
Do not.
In your county?
No.
So I would definitely reach out to public health, find out, and then we could certainly share with you our blueprint and see if that's a good fit for you guys to get. We're talking millions of dollars in almost every county in the state. So, personal with mental illness or behavioral crisis, and those with developmental or intellectual disabilities, IDD. So, so here's some numbers from our program. You can see that from our early, and this was early on in the program, obviously our numbers have increased significantly since then, but we brought in Anschutz, we brought in the position, third year students from Anschutz Medical Campus to actually kind of look at some of our data early on and see if we were making a difference. So what we saw is calls by gender. We've seen and we continue to see a slight balance in favor of women utilizing the service over men. And then this is by income group. This is the CHAP. So I is the highest income level, and then A is the lowest income level. A is 40% of the poverty level, by the way. So it's like less than $12,000. It's less than $8,000 a year for one person. So that gives you an idea of socioeconomically. You know, you can see that A, B, and C are three of our largest groups. So the most socioeconomically disadvantaged are the groups that we're actually having the largest impact on. Next to obviously the affluent, which honestly is just the highest proportion of our community. But we do have a lot of marginalized folks. You know, even though we have a lot of really affluential people, we have a lot of folks sitting on the other end of the spectrum that have historically been marginalized and isolated. So scope, again, we're utilizing well-trained community paramedics embedded with the 250-bit encryption Colsera technology. We really see it as bringing back the physician-to-house call. One of the things I tell people is we are not doing your mother's telehealth, right? We're not doing the telehealth that your insurance company encourages. That's not what we're doing. We're adding a third and fourth dimension to telehealth because we become the eyes, ears, and unfortunately sometimes the nose for the physician, right? So we can smell things they can't, see things they can't, hear things they can't, heartbeat, blood pressure, things that you can't historically get. We also do lab work, so we're able to actually do a CNP just like you would in an emergency room. We can do H&H panels, we can do urinalysis to rule out urinary tract infections. We can do strep A tests. We have the ability to do ultrasound and bladder scans. And then we have the ability to do pregnancy tests and COVID testing. So we didn't start out with all that. We just added a test or two at a time, got our folks comfortable with that, and then added more testing as time went on. So, and we really see ourselves as physician extenders, right? We can't have physicians in every single rural community in America, but what we can have is we can have a partnership with a physicians group that's willing to be available so that they can actually be there virtually in the patient's home and support the work that we're doing. And a lot of times we can start IVs, we can give medications, they can call in orders for medications. If the patient can't go and pick them up, we'll go and pick those medications up for them. So we're really becoming the value option for the community. We're reducing the cost of providing care in the community and increasing access to care for people. So, so total number of telehealth calls. So when this program was developed, we were at 44. We're many hundreds over that now. But as you can see, out of the home program, Medicaid, Medicare were basically made up 14, and then 8 of our calls were, were private pay, Kaiser, and then we had a small number of self-pay. So that's the income level again. There's the private insurance and each group. So we are getting private insurance companies to pay. Kaiser is really good at paying. They pay under the A0998. And then some of the Aetna plans are actually paying as well. So the one that's actually amazingly good at paying is Blue Cross Blue Shield. And another one that was really surprising was TRICARE. So retired military. So, auto insurance pays almost 100% as well. So when we run traffic accidents, we actually charge a different rate for traffic accidents because the risk is higher. And we're seeing payment from almost 100% of the auto insurance companies. So, and if you think about it, that makes a lot of sense. So here's the physicians that we work with and how many calls each of them have taken. And then you can see that we do a medication evaluation. So we do what's called, we look at social determinants of health to determine what risk factors the patient might have so that we can actually have a greater impact on reducing their dependency on the system in the future and possibly improve their overall health. And we've seen a lot of success with this. Fall risk assessment, we saw 35. 5 of those were positive, and those patients were actually referred to a program called Stepping Up, which basically provides them with an iPad, and they get to do exercises with a group through like a Zoom meeting, where they actually increase their balance, increase their physical strength, and reduce their risk of falling. So they also learn additional techniques that reduce their risk of falling. So screening B for intervention and referral to treatment. This just identifies patients who are struggling with substance use disorder or behavioral health crisis and gets them set up with the behavioral health or substance use services that they need. And again, we actually have teamed up with a group called the Front Range Clinic that also operates down in your area. And they bring a Winnebago to our office once a week and provide mobile crisis services mobile medication-assisted treatment services and counseling services for people struggling with substance use disorder. 30 of the patients up to this point that we evaluated did not require medications, but our physicians were able to order medications for 14 patients. So, and then out of those, you can see that out of the ones that required medication, about half the time, a little bit less than half of it, a little bit more than half the time, we would actually pick up those medications for the patient because they didn't have access to get those medications. So, next is patients with primary medical doctor. So, not having access to a primary medical provider is one of the main reasons why people don't get the medical care that they need. And what you see is that 5 of the patients early on that we evaluated did not have a primary care physician. And so we got those folks set up with a primary medical provider. And what we did is we reached out to physicians, told them what we were doing, and asked if they were interested in helping. And then we also got in contact with our safety net clinic, which is Peak Vista for us. Do you guys have a safety net clinic down there?
Not that I'm aware of.
I don't think so.
Okay, so do you know who sees your Medicaid population down there?
Do you know?
Tahoe is one of them. Then you have Carmel.
And that's something that if you guys decide you want some help doing your community needs assessment, I'll certainly reach out and find that and help you guys find that. So, because that's one thing is if you get somebody, you get them with DHS, you get them set up on Medicaid, the next thing you want to do is make sure that you can help them find a primary care provider. And really that's the stuff that makes a real big difference in reducing the number of patients who are turning to the 911 system. So out of ours, we had 1 patient that went to detox early on. We had 10 that ultimately did end up going to the emergency room, so about 25%. One patient received a direct referral, either to their primary care doctor or urgent care or something like that, and 31 of our patients actually were able to be treated in place without having to go anywhere, which I think is I really do think is an incredible number, and that trend has continued. So a lot of our patients did receive referrals to other resources. Even though they were left at home, we wanted to make sure they got set up with those additional resources. So only 6 patients did not receive any sort of referral. 24 patients received referral to their current physician. So it's, hey, we're going to provide you care, but you need to follow up with your physician within 7 days. And we help them, we try and call their physician and get that appointment set up so that we know that that's done. I'm not saying you have to do it that way. We've just had a lot of success with that. 4 patients actually got set up with a new primary care physician. 3 patients got referred to a specialist, so orthopedic doc or a pulmonary specialist or pain management specialist. 7 patients actually received social services referral, either through DHS or another entity. 5 patients received behavioral health, 5 physical therapy, 4 occupational therapy, and then 9 received some other sort of community referral. We also have a program called the FISH program, so if anybody's experiencing food insecurity, we've teamed up with our local food shelter, and they provide us with food for non-perishable bags, and we carry those FISH bags with us. It stands for Food Insecurity Support and Help. And if we identify anybody who's experiencing food insecurity, we'll actually provide them with one of those rescue bags that has a 3-day supply of food in it for 2 people. And then we'll get them set up with long-term food support services so that they can actually have that social determinant of health met through another community partner. I tell people all the time, we're not the answer for most things, we just know who has the answers. And that's really what a community paramedic program is. It's not super sexy, it's about referring people to the resources that they need so that they can get their social determinants of health met. So if somebody was starting a program, here's kind of some of my recommendations. I would send some of your providers to a community paramedic class, make sure that they understand what they're getting into and can understand the ins and outs of it and you know what the different dynamics are. I also would start working on forming a health service district, because you can't have a KISS license as an ambulance district. So if you guys are not a health service district already, I would certainly recommend looking at that. But I think you guys are still an ambulance district, is that correct?
Yes.
Correct.
Yeah, so I would recommend getting that going sooner than later, doing your service modification, and because that is going to be a major stumbling block to getting your KISS license. And then once you have your CPs, do a community needs assessment, and I mentioned this before, guys, it really doesn't matter to me. I'll support you in any way I can, but if you guys decide you want to bring us in to do some consulting for you, we'd be more than happy to help you do your community needs assessment. But if you don't go that route, I'm still here and available to answer any questions you guys have. We're here where we are today because other people helped us. So, and then get your community paramedics endorsed. Apply for your KISS license once you have all those other pieces in place, and then start signing your MOUs with your partners and find funding sources. And I think you guys have a lot of opportunities right now for funding, honestly. You have some real solid potential for bringing in some additional revenue sources for your community and for your programs. And that's it. Always end with babies or puppies. That's my rule. Was that helpful? Do you guys have any questions? Is that what you were looking for?
It was absolutely helpful. We're working on changing to a health service district, and we just kind of wanted to show the opportunity we have to go into the community paramedic program and some of the things that we can offer. So that was perfect.
Yeah. Really helps to make the case for a health service district. Not that the case wasn't made already.
Yeah, I'll tell you, I don't mean this, and I say this as humbly as I can. I don't think there's a day that goes by that my team doesn't make a difference in somebody's life. And we did that on the 911 side too, right? But here it's in a different way. And both are important. But this has a real sustainable feeling to it. Like, you're permanently changing somebody's life. You're not altering circumstances over a short period of time. And it's not to minimize what happens on the 911 side, because I think both are extremely important. But there's just something about somebody inviting you into their life in that really intimate way to make a difference that creates a bond with your community and with your community partners that I've just never seen before. All of our community partners value what we're doing, and we value what they're doing. And it really is such an incredible partnership, and you just can't do it alone. You can't make it happen on your own. And so by everybody working together, it's pretty special.
It's very impressive. Yeah. It would be hard to have all that all those things available and all those resources and places to go here, but go ahead.
Comment. Are you guys aware, we formed a health service district in 2008 or 9. I was elected to the first board.
I didn't know that.
And eventually, we weren't funded. There was 5 of us, myself, Jesse Manzanares, Mr. Lopez, Linda Velasquez, and Clay.
Wow.
So that was about 2009, 2010. And eventually, because there wasn't funding, I still have everything. It didn't dissolve, but eventually Carl Gaverson and people from the hospital had it. And it's my understanding, it probably is in limbo, but it still is in existence.
Wow.
Interesting.
Yeah.
It took 2 or 3 years. We met once a month for almost 4 hours at the college. Some very long, involved meetings. We had some really good people that wanted to be on the board, and it just didn't get funded. So, but we tried for several years. There was a lot of effort put into it, and it was because it could have been a tool for a lot of different things. But I would imagine, I don't know where an organization like that would be under Secretary of State or where, but
I'm not sure, but it's something that we would have to transition to from an ambulance district to a health service district. And it doesn't sound like the process is as intense nowadays.
it was passed by the people. Remember this, Clay? I mean, you were there for those meetings. So, but I think it's probably been shelved for a while without being renewed by whomever was on that board.
Right.
So it's possible, just like what's another situation where you might be able to step in and wake it back up. I'm not sure what the legal terminology would be.
Well, I think we have, more qualified legal counsel for that. It was here and I'm sure listening, but that's good to know. I had no idea, and I don't know if we would have to reconstitute the existing health service district.
I would imagine, from what I understand, we have to become the health service district
Yeah.
in order to.
Oh, yeah.
Because it takes the place of the ambulance district and then becomes the Trinidad, however the name nomenclature is of that is for the ambulance district.
Yeah, good to know. Thank you.
Do you have any
And
questions?
I would defer to your legal team for the specifics on that. I know that we were told we had to form a health service district before we could do the KISS license, because an ambulance district isn't allowed to have a home health care license. So that was the first thing, and then it was a super easy process for us, honestly. It was just I say super easy, but it was just a matter of submitting the paperwork to the Board of County Commissioners, and then having it go to the to the judge
Right.
for ratification. So, but again, your legal counsel can go more in depth with you on that. I just know that it wasn't a super onerous process for us.
Well, thank you.
Thank you, Tiny.
Absolutely. Do you guys have any other questions for me? Is there anything else I can do for you?
That was great, thank you.
Absolutely. Thank you guys so much. Have a great night, and feel free to reach out anytime if I can be of help in any way.
Thank you again. We'll be in touch soon.
Absolutely. Talk to you guys soon. Bye.
Are you gonna get to the resolution part there, Nicholas?
Does she have to talk yet, or is she just gonna be on standby?
Right, I know.
No, I'm here. I didn't want to interrupt.
I didn't know if she needed to go on or what.
You've been very patient.
Is she to go on?
I was chuckling because James's legal counsel is us.
Oh, nice.
That's funny.
Nice.
Correct.
Yeah, good, good.
Transition from their ambulance district to their health service district.
That's
So
funny.
you're definitely in good hands with working with them.
And with you, apparently.
Well, thank you, I hope so. Gabe, do you mind if I kind of reintroduce myself? Because I know you have a couple of new board members.
We do, please do.
Okay. So, my name is Catherine Nguyen. I'm a partner at the law firm. We're out in Denver of Collins, Cole, Flynn, Nguyen, and Ulmer. I have my associate Javon on the line as well, who's been helping me work with you guys. So Gabe contacted me a couple of months ago to kind of talk about this concept of really what started as we need to amend our service plan, and then the more we talked, the more he saw this need to do this type of community paramedic program. And so we came to the board, I think it was last month, and talked to the board at that time about the different avenues for amending your service plan, and that if you were going to amend your service plan and you were also looking at doing this type of community paramedic program, that you really wanted to combine the two. Because as James mentioned, in order to have that program, you can't be an ambulance district. You do have to be a health service district. But the way that we become a health service district is through a service plan amendment. And the unique thing about health service districts, which James kind of touched upon at the end, is that the approval process is fairly easy from the standpoint of you do have to work with the state on your licensing, but that license then qualifies as your new service plan that transitions you to a health service district. So we have to do kind of one avenue through the state, and then we have to take that license, and we have to go to the county commissioners, show them that we have the license. We have to do a public hearing, but they don't have any authority to deny that service plan for a health service district. And then we go to the courts and file it. So the board at that time last month expressed a lot of interest in further exploring this health service district concept. And so, Gabe went out and recruited, talked with James and had him present to you today. We do have a resolution in your board packets and on your agenda, which if you want to consider it, would be kind of the kickoff to transitioning to a health service district. It would allow us to then start the process of getting the licensing, and then also start the process of the of the service plan amendment. So that's what's really before you today. I know this is kind of new for a lot of the new board members, so I'm happy to answer any questions. I'm happy to talk more about the licensing program, a little bit beyond what kind of James had touched on, if that's of interest. Really just here to answer any questions that you have and help.
That's pretty cut and dry for me. We had the beginnings of a community paramedicine program at Grady in Atlanta with behavioral health, where we had state representatives for behavioral health organizations and paramedics with Grady that would respond to calls and take some of the load off. So to me, it just becomes a Colorado version of that.
Yeah.
Murphy?
All right, go back to my chair.
All right, so we need to vote on resolution 2023-04 service plan amendment. Obviously, questions, does already.
Now's questions.
Sure.
So this isn't to pass it, this is just to investigate it.
To begin it.
This is to begin the process.
This is saying, yes, you want to move forward with becoming a health service district.
Okay, that's all it is.
Yes.
Okay.
Okay.
Good with that.
So we need a motion, we need a motion on the.
Now you
on
gotta
the
step
floor.
up.
I'll make a motion.
And let me, can I just add 2 things before we have our motion? I just want to make sure the board has the full information. There obviously is some cost to doing the service plan amendment and the license. The initial licensing fee is, through the state, is $3,000, and then there's an annual sort of renewal fee, which currently is $1,700. There's also a cost to do the service plan hearing and the court filings. I don't really have an estimate for that, but I do want the board to kind of understand that, that there are some additional costs with that. I will also say that I noticed in our resolution, and I apologize, in paragraph 3, we kind of used an old term for the name. It says Health Services District, so your name would legally change to Trinidad Health Services District. But we want to change that before your approval to drop the plural. The statute was changed a while ago, and it actually is Health Service singular district. So I don't want you to accidentally, with our sort of error there, approve the wrong name. So you want to include that in your motion, I think, and we'll get you provide resolution sign.
Yeah.
Sorry, the radio was going off. We got it.
So Andres, if you want to make the motion, just make sure you mention that to change the name that's in the resolution.
Okay, I'll make a motion to approve the 2023-04 service plan amendment with the changes of the Trinidad Health Service District.
And I need a second.
I'll second.
There you go.
I'm in, baby.
All right, so we will vote. So Nick,
Yes.
Andres,
Yes.
Zach,
Yes.
and Tom.
Yes.
Awesome. I think it's gonna be a great deal for our community. It's gonna bring a lot to the table.
Yeah, it's nice to see it starting to come to a head, because when I was on the truck, it was still, they were talking about this being a concept. And it's what we do with most regulars, is teach them how to take their medicine or help them through a moment, as opposed to needing to go to the ER, so.
Yeah.
All right. Any questions for the lawyer?
I do. Catherine, the one question, you were gonna reach out to CDPHE. So in the meantime of our last conversation with you, we're actively looking for a community paramedic program, which will basically give us the knowledge to pass this board certified test. You had mentioned that you were gonna talk to them about if we have to have those people in place certified prior to the KISS license. Do we have any movement in that?
Yeah, I got a little bit of a runaround, and so I now have the correct people to talk to at the state. So I don't have an answer for you today on that. But I think, James did talk about from their experience that they did, I think, start with that certification. So they had that in place. Because you will have to, as part of the licensing, and James mentioned that you'll have to do a cultural assessment, and then the state will also come in and look at your kind of policies and what you have set up. So while I don't have an answer, I think it would be smart to kind of start going down that road, because I suspect the answer is going to be yes. And I did want to ask, I think one of the board members mentioned that you think there may be a neighboring health service district that was organized at one point, but perhaps not operating. Do you recall the name of that? Because I just want to look it up.
Wouldn't that be
No?
nice?
Huh?
Wouldn't that be nice if I could remember?
Well, I've been trying to remember.
They still meet.
They do still meet?
Yeah, they still meet.
There's Trinidad Area Health Service.
Yeah, I just don't remember.
I have I have files at home. I could find them in 5 minutes, 2 minutes. I know where they are, but I'm getting it confused with Taha in my head.
Oh, yeah.
Yeah.
But, I mean, I've spent a lot of hours filming and being there and then meeting briefly afterwards, but we had no money and there really wasn't much we could do as a board.
Could you let us know the name?
If you want
so
to
we
email
can
that to
let
either
them-
Gabe or I,
Yeah,
and then we
Yeah,
can get
I
it to
go back, I
Catherine.
still have all the tapes.
Good, just,
Just
Don't
me.
want to relive that, that was,
I bet, right, right.
So we'll get that to you, Catherine.
Okay, that would be great.
I'll
thank
bring
you.
it to you tomorrow, I have it.
Alright, any other questions for? Good? Good. Thank you.
All right, thank you. Gabe, I got your out of office email that you're on vacation.
Yep, I'll be gone tomorrow.
Today was his prep day.
I'd say let's touch base when you're back.
Okay,
We can start the process.
okay, sounds good.
Great.
Javon, you're
Thank
very
you.
quiet.
Yeah.
Yeah.
I think I don't want to click the button.
That's right.
I don't want to unmute. No.
I wanted Javon to have some of the background and just kind of meet everybody tonight. He'll be helping throughout this process.
So you have the resolution.
Thank you,
It needs to
Javon.
be signed.
I got it signed there. Just gotta change,
Thank you.
just gotta change that, whatever, yes, whatever they want to drop off or whatever. And then send it to, Andreas to sign it. Wish I did that, secretary.
Are we done with them?
Yes,
I
thank you
think
guys.
so.
Yep, Mr. Dunn.
Thank you both.
Thank you, everyone. Good night.
Good night.
Okay, miscellaneous, this was Clay's deal, miscellaneous.
So I just crossed that off.
Can I have a few minutes?
Thank you.
Okay. So as I was preparing for this, guys, I went through and I wrote out some questions, and some of these are comments, they're just general. Thankfully, though, when I came, I got this. So I just still want to go through these, but more than likely, most of my questions have been answered. So I was hoping there would be some board training and orientation, but having done as much stuff with boards, most of my answers are going to be in here. So, but I did look up Title 32. I put it on my phone because I was afraid maybe that there wasn't. I didn't see anything. And I thought, there's 545 pages. I was like, oh no. But I'm that anal, I use that on camera, that I would have read through it. Because if you don't know the rules of what you're doing, then you're gonna run into some issues. So this will help. Since 2005, there's probably not too many people in this country that have sat through more board meetings than I have. And so I was also a board president 30 years ago at the YMCA and a board member. And so board conduct is important to me. And in that the board, we need to know that we have one employee right here. At the city, it's the city manager and the attorney. But it's my understanding that Mr. Downs is not an employee here. I think you're just contract.
Correct.
I've seen people that on really good boards and really bad boards, and the people that are on bad boards don't realize how bad they are because they're business people or whatever, and they think that they can be on a board and do the things that they do in their own business. But I'm a big believer that as a board, you need to know what your role is. And so that number one is that we speak in one voice when we give directions to you.
Right.
And so that's number one.
Amen.
So let me go through a few of these things. It was just board training and orientation, special district laws, which are here, Title 32. Thank God that's not 545 pages. In any business, in whether it was a YMCA or whatever, we had articles of incorporation, and because it's a special district, that may be called the charter.
We have bylaws.
That was next.
If you go to
I looked on the
our
website.
website, we have our service plan.
Okay, I think I had that right here. Well, I
Yeah.
have the mission statement. Okay, I just missed it, maybe.
We don't have a charter.
Do you know, or articles of incorporation, but yeah, the bylaws are
We have
there?
our bylaws.
Okay.
Mhm.
So with this, policy and procedure for boards, this is general. Do we have policy and procedure specific to Trinidad Ambulance District?
That's, I
For
apologize.
board, for the
I-
board,
Not for the board.
okay, all right. This is a separate issue, but I was looking at the resolutions, and there's still a resolution on there from 2014 that Dan does not the agenda, but the budget.
Mhm.
So has that changed, or is this still in play? Is he doing the budget?
No,
No, he's not doing the budget. The
Executive
does the
director.
budget.
the executive director.
I think it has his name in here.
Does it?
Yeah.
Yeah, Executive Director Dan Moynihan. And he didn't do the budget last year, right?
No.
Something as a board we might want to look at
Sure.
and just clean up. Being a small town, I run into some of the people in the ambulance and whatnot. Would it be possible to get an organizational chart and pictures so that we know who the employees are?
So
when we come across them?
again, I apologize. I usually have a binder for you on your first day.
Okay,
And I don't, because I haven't gotten them back from the other board members. So all of those things, our organizational chart is in there. We don't have pictures of the employees, but we do have the organizational chart with everybody's names and how the district flows.
it would just help. I mean, because I run across them, it's like, and people say hi. I mean, I'm on camera and stuff like that, and people say hi to me, and like, I don't know who they are. So I'm kind of embarrassed. When I did the meet the candidates at my place, and I'd done the research, you probably have a physical map of the district, because there's a piece of Los Angeles County that's cut off, right, in the east, that's not part of it. I'm a visual person, and so just having something that says, here's our area.
It's Los Animas County with the exception of Kim's school district.
So if the county has the school district map, that would be it?
Yeah,
Correct.
yeah.
Okay. And so, as a board member, do you have an annual calendar that, in January we're gonna do this, February we're gonna do this, March we're gonna do this, certain month maybe budgeting, anything like that, so that we're, ready, and we're not just reacting to like, oh, forgot that I was gonna do this month, so that we have an annual calendar?
No, not as far as the board goes.
So we might want to talk about that, so that if there's something that we do every year, that we just put it down, and we know as a board, at least for me. I'd like to look ahead.
Isn't about the only thing budgeting?
I was gonna say, just
Yeah.
Budgeting.
below the
Is a
budget,
regular
Yeah.
time at a certain time of year when you need to.
that would be about it.
He does
Okay.
that, that's done like what, November-ish?
October.
October-ish,
Oh,
November.
yeah.
Okay.
Okay. And then, I know there's a lawsuit out there and you're moving to a new building. I'd like to get educated on those things.
Okay.
And again, going back to being as a board member, if I need to come here and read that, and need to let the other board members know, I will never cross the line. If I'm coming here and asking you for something, I'm never gonna give direction. It happens, Les knows, and in some boards more than what we'd like to see happen, but I believe in those boundaries. So but I do wanna get educated on those issues.
Okay.
And so we'll reach out and say, okay, let me know, because I don't wanna, it's like this health service district, it's like I'm not totally comfortable on making a decision like this quickly without researching it. I know what we're doing, but it wasn't a big decision tonight, so I was okay with it. Everybody else, and 4 out of 5 board members were comfortable with it, so it's like I can go with the majority. So
Could we please have an executive session on the next meeting for me to update the new members on the litigation?
That would be awesome.
Yeah, absolutely. And that will kind of also dovetail into, beginning of the conversation for, I think, why the health service district was considered, in addition to the many other reasons like you were saying, Zach. But anyway, so if we could please have an executive session, and I will plan on doing that if that's acceptable. Don't mean to interrupt you. but just trying to-
that's it. I got prepared last night today, and these are kind of all over the place, but again, having been to as many meetings and the city has stuff like this, it's like, this is really helpful.
That's a great book, and we've actually, they do have a board of director class in Fountain. And we went to that one year and it really wasn't helpful as it was more geared toward towns and cities and water departments. It had very little that impacted us other than in how we operate our meetings. So,
Well, with
so
that-
yeah, that's something you'll be able to look into.
But again, as I said, we, as a board, whether we agree or disagree, whatever decision we make, we all need to get behind. And there's one employee here, and that's the director. So, that's all that.
And I'll be gone till June 5th, but anytime you want to stop in and just kind of get filled in on how everything works and what we're doing, I'm more than happy to sit down with either of you guys.
Yeah, it might be nice to even just make an appointment and kind of have an hour or two to show them around and.
Yeah,
The
I'd
new
like
building
to-
and the loan process and all that stuff.
Yeah,
Yeah,
that
I'd
goes
like
on.
to come in and meet crews and stuff anyways. so.
But well
Come
said, and
tomorrow
speaking.
for lunch,
Yeah, that's actually, that was the first plan that I had.
11 to 2 tomorrow, come for
And,
lunch.
and again, I told you guys when I was here before, you guys saved my mother a couple times, so thank you.
Absolutely,
Good point.
absolutely.
They're good at what they do.
Yes, they
Yes.
are.
Yeah.
But well said, speaking with one voice. It's a
I like
very
that.
important
Yeah.
concept, yep,
Yeah.
absolutely.
All right, very good. So the next board meeting is June 28th? Is that correct?
I hope so. Of course, I made the coffee, so maybe we
Yep.
should check.
I got June 28th.
All right.
Are we always on Wednesdays? I thought they used to
It's the
be on-
4th Wednesday.
Okay, I thought they
Yep.
used to be on Tuesdays, but that's probably city council. I'm thinking of.
Yeah.
They are Tuesday. And once again, even if you don't meet with Gabe or whatever, I've got documentation binders for board minutes and financials and the lawsuit and all that. I've got everything for the new building and stuff, so if you ever wanna come in and just look through stuff, help yourselves.
The building thing's been a process, just so you know. We'll get the brunt of it as it moves forward, but this has been probably, what, 3 years in the making at least?
Yeah, two and a half, I believe.
Yeah, so,
19.
we haven't got too far yet, that's about it. All right, take a motion for adjournment.
Make a motion for adjournment.
I'll second it.
There you go.
Yeah.
You're right in
Bring it up
there.
in
Yeah,
Texas.
yeah.
All right.
Taking charge.
Nick?
Yes.
Andres?
Yes.
Tom?
Yes.
Zach?
Yes.